So if you're playing this video, you probably opened it up because you were wondering, what am I doing holding what looks like a giant odd-shaped Q-tip? What's interesting is this is actually an oral swab. We've been doing some really cool genetic testing now here at Innovative Health and Wellness Center. And the reason we decided to do that is because I always joke that no matter what happens, it's always your mom and dad's fault, right? And as much as we can change that, there's some truth to that. When we look at genetics and we can trace back things that we look at in health, we can help to determine if there are some things we should be paying more attention to or less attention to, or doing things different. So this testing that we're now doing looks at a couple different things I want to share with you. One, which is really cool, we can look at a whole bunch of different genetic SNPs to see if you are more prone for certain diseases so that we can keep that light switch at bay. Let me explain that. I believe that you are born with this light switch sitting in a neutral position. And genetically, you may be destined for certain things. And if we don't take care of and look at those certain things, we can flip that switch on and you can wind up with those disease patterns. Or we can do some really great work through diet, through nutrition, through supplementation, through exercise, through lifestyle, and we can keep that switch actually turned off, even out of neutral, so that you don't wind up with those things your genetics say you're determined to have. We can test that now, which is really cool. The other part of this test, for those of you that are involved in any sort of sport, whether you're a weekend warrior, you love your Pilates class, you love your HIIT training, or you're a serious athlete, we can look from a sports perspective genetically what works for you. So for example, I ran my own genetic testing and mine came back showing that I actually do well and feel healthier and perform better when I exercise really hard with HIIT type training, high intensity training, allowing recovery in between sessions. Versus there are other people who test and show that they do better, let's say with yoga or Pilates, and doing it daily. So for those of you that are also working out and saying, these workouts aren't going exactly as planned, or I'm not seeing the changes I want, maybe you're actually not utilizing them correctly based on your genetics. We also can look at things like food. So let's take another example, the keto diet, which is very popular right now. Lots of people swear by that. It's the best thing that ever happened to them, right? So I tried the keto diet for about 2 weeks and I thought, wow, I really just don't feel great on this. And yet I do very well with protein and eat very healthy fats typically. But when I increased my fat content, I didn't feel good, even though they were good fats. My genetic testing actually revealed that I don't absorb and break down fats as well as somebody who doesn't have that genetic SNP. No wonder why that keto diet didn't work for me. So we can get you some really cool answers as to why things aren't working, and at the same time, get you some answers as to how to make changes in order to be more successful. The other part of the genetic testing is for those of you that are on any sort of prescription medications. Even though we don't do prescription medications here at Innovative, I do understand that there is a time and a place to utilize prescription meds. What's great about the genetic profile for this is we can actually determine if, based on your genetic SNPs, if the medication that you are taking will actually work or be more harmful. So you've all heard people who have taken a medication and gotten more side effects. It could be because genetically it's not a match. So whether you're on a medication or contemplating taking a medication, pull out the Q-tip, let's get an oral swab and find out and make sure that what you're doing is actually going to be more beneficial than harmful. Any questions on this? We'd love to answer it. Just give us a call at the office. I'd love to talk to you about your genetic SNPs.